Ladies and gentlemen, welcome to the opposition's media briefing on today's Sunday. Thank you for joining us. Today with me is the eminent physician, Dr. Tim Gopi-Singh, who will speak on the governance and management relative to the COVID-19 pandemic, and, well, I suppose the Minister of Health statement when he said there is nothing more he could have done, or something to that effect. I will address the Act to amend the THA Act 2503 and to make consequential amendments to Election and Boundaries, Local Government and THA Act 25.5, and also make some brief remarks about the National Gas Company and that headline in the last week, Saturday's Guardian, where it would have been reported where they would have lost $250 million. Thank you. So now I pass you on to Dr. Tim Gopi-Singh.
Thank you very much, Deputy Political Leader of the United National Congress and Senator Jolene John. Good morning, everyone. It's a privilege and honor for me to speak this morning on the important issue of the governance and the management of this COVID-19 pandemic in Trinidad and Tobago. As we speak, there are approximately 194 million COVID-19 positive cases worldwide and 4,160,000 deaths. The United States has had about 610,000 deaths, India 419,000, Brazil 548,000, Russia 150,000, France 112, and UK 129. Now, India's population is about 1.4 billion, and our population is 1.4 million. So India's population is 1,000 times Trinidad and Tobago. So by extrapolation, if we have over 1,000 deaths now, 1,000 by 1,000 is 1 million, so our death rate is equivalent to 1 million of deaths in India. But India's death rate is 419,000. So our death rates in Trinidad and Tobago is approximately twice that of India. So when we in Trinidad and Tobago and the rest of the world were concerned about the amount of deaths occurring in India, here it is right in Trinidad and Tobago, we had twice the death rate as that of India. In the World Odometer's publication of COVID-19 cases and deaths per million in 203 countries as of July 22nd, 2021, Trinidad and Tobago death rate, 719 deaths per million population. 719 deaths per million population. We are number one in the Caribbean in terms of the highest death rates per million population, and number 53 in the world. Jamaica, with 2.95 million population, had 394 deaths per million. They are ranked number 71, better than Trinidad and Tobago. And Barbados ranked 143, even better than Trinidad and Jamaica. So we are worse than countries like Libya, Iraq, El Salvador, Dominican Republic, Kazakhstan, Indonesia, Philippines, Malaysia, United Arab Emirates, Zimbabwe, Venezuela, and Haiti, which has a death rate of 118 per million population. Cuba has a death rate of 182. They have 182 deaths per million. So our death rate is 4 times that of Cuba in terms of where we are. Now let's look at vaccinations. 27% of the world's population have received 1 dose, and 13.6% of the world population fully vaccinated. That's about 1 in 8 of the world population, which is about 7.4 billion globally. 3.83 billion doses have been administered globally, and 30 million doses are administered on a daily basis globally. Where are we in Trinidad and Tobago in terms of the 33 Caribbean countries that are reported about in Johns Hopkins University reports, the World Odometer, and WHO reports? 28 Caribbean countries out of the 33 have vaccinated a larger percentage of their population. 28 out of 33 have vaccinated a larger percentage of their population than Trinidad and Tobago. Trinidad and Tobago is fifth to last in our Caribbean 33 countries at 17% vaccination. St. Kitts Nevis is 49%, Barbados 34%, Guyana 31%, Antigua and Barbuda 36%. And the Ministry of Health, you remember Minister Diyal Singh saying we are first in the world, when they were dealing with the testing and from Oxford University. Well, here we are, unfortunately, by their management, we are fifth to last in the Caribbean countries in terms of vaccination at 17%. How unfortunate, and what we consider total mismanagement. And just yesterday, Minister Diyal Singh, with his nonsense propaganda, talking about we are 7th in vaccination. 7th in vaccination, he came out yesterday and said, we have 17% of vaccination for Trinidad and Tobago, and we are fifth to last out of the 33 countries in the Caribbean. But when Minister Diyal Singh doesn't even know what is the national anthem, what do you really expect? Do you really expect him to have a lot of discipline, production, and tolerance? I think we have to have a lot of that to tolerate Minister Diyal Singh, discipline, production, and tolerance. So, as I speak to you on the major issues related to the over 850 COVID-19 deaths in May, June, and July of 2021, nearly 10 deaths per day at an average, and also his hapless statement made by the Minister of Health, and even statements made by the Prime Minister and Chief Medical Officer regularly, and the other 3 doctors. Have we asked at all why has there been a surge in deaths over the last 80 days? And how many of the lives could have been saved? Did the 850 citizens who died, did they all have to die? Could their deaths been prevented? We have been asking for months for information related to that, from the 4 doctors, the Minister of Health, the Prime Minister, and can they account for the deaths of these COVID-19 positive patients who became critically ill and died? No answer has been forthcoming. Where did they die? Did they die at home? How many died in the ambulances while being transported to the hospitals? Did they die in the emergency tents at the San Fernando Hospital, the Eric Williams Medical Science Complex, and General Hospital, Port of Spain? Those answers are not forthcoming. How many died in the intensive care units and the high dependency units of Couva Hospital, Cora Hospital, Arima Hospital, and Augustus Long Hospital? How many died because of serious mismanagement of the system by the Minister of Health and his team? The Minister, Prime Minister, and their medical teams of Drs. Parasram, Hines, Dr. Abdul, and Dr. Trotman have never sought to provide any information to the nation on these issues. Is it deliberate? Why have they failed to do so? Why have they failed to do so despite these questions being asked for months? Why do they continue to hide under their incompetence? Because they know that they could be found guilty of not taking timely, appropriate action to prevent the loss of lives in the ICUs and HDUs, particularly over May, June, and July 2021, and still continuing. The Minister of Health and his team have deliberately failed to provide this information on the mortality rates of the ICU, intensive care unit, and the high dependency unit. How many have been admitted to these units, and how many are fortunate to be alive today? No answer has been forthcoming. So how would be to determine the efficiency and effectiveness of medical care in the ICU and HDU? Thousands of citizens in Trinidad and Tobago have been asking these questions. They have been calling me, asking me. I said, I don't know. The ministry has failed to. So instead of these 3 doctors on a daily basis standing before the television, talking and having political platitudes and so on, they should do the research work and present that information to the population. I believe I reminded Dr. Parasram of that at some subsequent time about a month ago. And what is the mortality rate in the ICU and HDU? Because people want to know if when the families go in there, is there a chance of them coming out alive? From my understanding, that is not 9 out of 10 from what I've been told, or 8 out of 10 pass away, unfortunately, in the ICU units. We have to get the information from the authorities. They will not tell the population that information or give them, because they know that is we are one of the worst in the world in terms of management in the intensive care units and ICUs. They are ashamed to provide this statistical data. Let me go on to what in the Trinidad Guardian, July 21st, Minister Dayal Singh said, there is, and I want to quote him, "There is nothing we could have said to have done better or differently. Some good could come out of this if those who are diabetic take better care of themselves so they don't become statistics for other pandemics." Unquestionably, this statement by Minister Dayal Singh is abominable, it is callous, it is insensitive, and totally unacceptable. He said this in a cold, remorseless manner. Imagine the Minister of Health saying something good has come out of 1,000 patients dying from COVID-19. What good could come out of 1,000 patients dying from COVID-19? This is disgraceful and a heartless statement. And he should be fired just on making that statement alone. You saying that it is good that 1,000 patients have died and something good will come out of it? Or he should have resigned himself. Imagine, ladies and gentlemen, the immeasurable grief and suffering of these 1,000 families. Where is his humanity and compassion for the grieving families, some of whom generations have been wiped out, as we saw recently in the newspaper? Here it is. 1,000 deaths have taken place in Trinidad and Tobago over a period of time. And particularly within May, June, July, TNT records a grim milestone and the faces of the unfortunate citizens who have passed away. And then, here it is again. CMO, diabetes, a leading cause of death. COVID wipes out family. Mother, daughter, granddaughter die. Yes. Did we really have to reach there if work was being done properly? Has this government and the minister addressed the issues in a timely manner? Hundreds of these lives lost could have been saved. So the minister is saying something good coming out of their deaths. Then the Prime Minister hypocritically bemoaning their passing because he is refusing to use his ultimate authority to provide, to implement the important inquiry into the deaths of these patients. He has that important responsibility, and he is refusing to do so. And is it because you have uncontrolled diabetes, you must die, and something good will come out of it? And what he says of these patients' deaths, had this government and minister addressed the issues in a timely manner, hundreds of these lives lost could have been saved. It is an outright tragedy, which is ridiculous, inhumane, and insensitive words. He and his team have failed to perform their jobs effectively, competently, and with dangerous, misinformed, and unwarranted hubris. That's a dangerous attempt to gaslight the population. And I want to echo the leader of the opposition statements when she said that these doctors who come out on a daily basis and make these statements, they must be removed and replaced because they're not doing what they're supposed to be doing. They are public servants, and they must be accountable to the population. The population pays their salaries, and they can't come and be platitudinous to the political party and the government in power just because they sit with the Prime Minister and the Prime Minister's team. They have to give objective information. They are professionals, and professionalism must be their watchword. And so therefore, we demand important information from them. They started with under-testing, and the under-testing went along for a number of months, and they did it deliberately to present false information to the general electorate for election purposes in March to August 2020. The Ministry of Health and the government, they were unready to deal with the COVID pandemic in those months from March, and they failed to provide personal protective equipment, test kits, testing in hospitals, as promised by the minister. He failed to accept help from the private sector labs, saying that testing would have taken place in hospitals, which has never even started up to today. And now over 120,000 tests have been done at private labs, paid for by our citizens. Over 120 million citizens have paid from their pockets to pay for these testing. The Ministry of Health can be accused of dumping of citizens in rat-infested homes in the early days and unsanitary places for quarantine. And the Minister of Health was falsely claiming he has enough spaces and facilities for quarantine. Today, almost 8,000 COVID-19 positive patients are quarantined in their own homes, unfortunately infecting their loved ones, some of whom die subsequently. So when the country is asking, well, why are we having so many 100, 200 positive COVID patients, it is multiplying within their own homes. Then the minister claimed he has enough ICU beds, and he claimed that he can get 72 ventilators and ICU beds can become available. Today, the health teams are struggling to keep the patients alive in the total 24 ICU beds in Couva, Augustus, Long, and Arima hospitals. And look at the statistics in May, June, July. Imagine we have 24 ICU beds in a COVID pandemic, COVID-19 pandemic, and for 1.4 million people. That's a shame. The minister should hang his head in shame. The refusal by the Ministry of Health to resolve the issue of 17 senior doctors' unhappiness, despair, and dissatisfaction with the Central Regional Health Authority Board and CEO Davlin Thomas. They deliberately frustrated these doctors. They gagged them. They gagged the doctors' complaints, and they were thrown out of the Couva Hospital at the end of April, removing 6 senior, very qualified and experienced intensivists, anesthetists, pulmonologists, nephrologists, replacing them with relatively junior, less experienced doctors to manage the ICU and the high dependency units. Is it surprising that we are having more deaths in May, June, and July, and a surge of deaths, when you have removed 6 of the best that you could have had, and you have another 11 gagged who cannot give any information and add to the management of these patients? The surge in deaths began in May, June, and continuing in July. So is there a direct correlation with the increased deaths and the pushing aside of the very valuable medical expertise of these 17 senior doctors at the end of April? They were removed in April. May, June, July has had a surge. Can Dr. Parasram and Dr. Trotman and Dr. Abdul and Dr. Hines give any information as to that? Why has that happened? The Minister of Health has failed to protect and preserve the health, safety, and lives of citizens due to his acute and often questionable mismanagement. The government, the Prime Minister, Minister Dayal Singh, who offered a plethora of advice and suggestions and recommendations from the opposition and from very learned citizens in the field of medicine. but they chose to blatantly, arrogantly, and dangerously ignore them. Government refusal to have the pandemic discussed 5 times in Parliament, raised as early as January 30th, 2020, 3 times in the upper house and twice in the Senate. There were repeated invitations from the opposition leader to formulate a bipartisan approach to battle the pandemic, deadly ravaging effects, and outright refusal by the Prime Minister of the opposition assistance and support. That tells you something. Here it is, the opposition leader pledging her support for the government and for the people of Trinidad and Tobago, but the Prime Minister bluntly refusing. Around the world this is happening. The opposition government have come together, but here in Trinidad, autocracy and dictatorship persists, which is in keeping with the Prime Minister's rule over a period of the last year and a half. The Ministry of Health failed to provide and employ adequate nursing personnel, as stated by the Nursing Association, and also they failed to bring on more experienced specialist consultants to manage the care of patients in the ICU and high dependency units. So when Minister Dialsing says that nothing more could have been done, these are things that he could have done and implemented, which he failed to do. And he wants to cast the blame on the people who are diabetic and say, well, it's good something come out of it because you're diabetic, because you're hypertensive, because you have asthma, because you have chronic obstructive disease, because you have cancer, because you have an autoimmune disease. These patients live a normal life, but if they have COVID, you're supposed to take care of them with the medication and the management to protect their lives and save their lives. And don't say because they have diabetes, they must die. The Ministry of Health failed to provide support, care, monitoring, and medical assistance for, at one time, there were 10,000 COVID-19 positive patients at home. Now there are about 7,000, left by themselves. No pulse oximeters, no medical monitoring and advice, no oxygen concentrators, no medication, no efficient transport from home to hospital when patients became critical at home. That all of that is happening and is still happening. There are about 7,000 citizens at home needing support and advice and medication, and they can't get it. The Ministry of Health fails to give anything to them. Patients were being placed in emergency tents at hospitals, sometimes for 7 days, awaiting COVID-19 test results, because you don't know whether they're positive or they're negative, so they can't move, but they're suffering. We know it's COVID positive, but we have to wait for the results. They don't even have a bed to lie on. Some of them did not have oxygen to be given to them before they were even considered to be transferred from there to a comprehensive medical care. Well, I just spoke about the vaccine failure. Well, the whole Trinidad and Tobago and the world knows about the Prime Minister's failure on the whole vaccine situation. When he says he does not beg, we're begging. And that, the whole of Trinidad and Tobago knows where we are now. Five areas from the lowest, 28 out of 33 with our vaccination program. If Trinidad and Tobago had received the vaccination at an earlier stage in a more rapid manner, we would not have these amount of patients dying as we're having them today. And what did you do about the 60-year-olds? We have close to about 200,000 above 60 years. Why did we not ensure that they received the vaccines very early? But here you brought them out to come out in the rain and have them huddled in hundreds to be told that you don't have enough vaccination to them. And then there was the Prime Minister inviting 50,000 citizens to go to Tobago. Come on holiday in Tobago. I wonder what happened to his thinking then when he invited 50,000 people to come and mingle again. My friend, Prime Minister, what happened to you then? Why did you do that? This is what is causing the problem in Tobago at this time. And why are you refusing to set in motion a commission of inquiry into this COVID-19 pandemic management? And you're also refusing and fail to appoint an independent team for an inquiry into these deaths. You know why. I don't know, we don't know why you are not doing it. Because your government is accused of callous, naked incompetence, mismanagement, and failure, and that is being laid bare. But Prime Minister, one day it will be done, you know. This commission of inquiry will be done. Yeah. And the inquiry into these confidential debts will be done. I'm being advised, so whether you want to do it now or you don't want to do it, it will be done someday. I am being advised that many bereaved family members are contemplating initiating legal action against the state and its agents in the passing of their very dear loved ones. And under the Freedom of Information Act, they will be seeking full disclosure on their loved ones' management, care, and passing at the hospitals. My dear friend, Honorable Prime Minister, I have noticed that suddenly, for the past week, you have started running around saying, I am not a dictator. I'm not a dictator. Every other comment you make, you punctuate it with, I am not a dictator. As Shakespeare would say, Honorable Prime Minister, methinks you doth protest too much. Methinks you doth protest too much. Let me say this. Your blatant refusal to fire Minister Dayal Singh for his ongoing dangerous blundering and incompetence, and your ongoing refusal to accede to the wishes of a traumatized, battered population, to use your authority to commission that inquiry into these very tragic, preventable COVID-19 deaths. Is this proof of you being a dictator? Ask yourself, why are you not doing it? You're being accused of being a dictator, and these are the issues surrounding it. This inquiry must be done now, and now announce the inquiry now. And while I come to the end, I want to give some advice to my 4 medical colleagues who come on television every day, whom I had the privilege and pleasure of teaching 3 of them at various times. COVID-19 hospitalization in England surveillance system. Have you heard about it? They collect data on patients with COVID-19 admitted to critical care. Have you heard about 108 English National Health Trust submitted data to this hospital surveillance system? 30-day mortality rates are circulated separately for high dependency units and ICU units by weeks of admission. This research findings assist and guide, 1, advances in clinical management. But I know that all 3 of you have not worked substantially long in hospitals. You went on from being an intern to a house officer, and you went in training in public health. But hospital experience need to be taken into consideration. Get some help, Dr. Trotman, get some support. My understanding is that you are in charge of all the admissions and management and transfer of these hundreds of patients on a daily basis. How can one person be managing that? And where is your research to help you in further clinical management? Reduction of strain on critical care services. Strain, what is the research being done in Trinidad? Evolving research findings have been central to informing and improving treatment. Evolving research findings, where is that being done in Trinidad and Tobago? Have been central to informing and improving treatment strategies. There is an undeniable association between critical care staffing, service strain, and patient mortality. There is an undeniable association between critical care staffing, service strain, and patient mortality. Is this happening in the ICUs and in the HDUs? Pharmaceutical treatment and management. My understanding is that a lot of the RHAs owe these providers of pharmaceuticals and equipment and other things needed for management. They are not paying them, so they're not providing it. And a lot of pharmaceuticals and reagents necessary for testing are not available in this COVID-19 pandemic time. So what do you expect? Don't you expect the patients to die? What about the D-dimer tests? Where are your vasopressors to keep the heart beating stronger when patients' hearts are failing as a result of it being in the intensive care unit? Where there is a significant impact of critical care organization when you do your research. And there are models of nursing care delivery. Have you looked at that? Have you implemented that? The improved survival of critical care COVID-19 patients is consistent with recent research. Where's your research? How many patients are dying? How many come out alive? Why do they die? There is significant research being done internationally on critically ill patients that help to guide clinicians' understanding of the evolving outcomes of patients in order to improve and undertake further targeted clinical management in ICUs and HDUs. But nothing is being done in Trinidad and Tobago. I want to repeat that. There is significant research being done internationally on critically ill patients that help to guide clinicians' understanding the evolving outcomes of patients in order to improve and undertake further targeted clinical management in ICUs and HDUs. Sadly, painfully, no analyses, doctors, no statistical data available, nothing, Honorable Minister of Health, Honorable Prime Minister, nothing. Where are we? Are we a Z-world, in a Z-world country? We have bright brains. We have some of the best doctors in the world here in Trinidad. Bring them together, ask them for some support. But you are an autocrat and you get up on television every Saturday and tell the country, well, X amount of vaccine coming and they don't come, and X and Y. And the doctor's telling you about this graph and this color graph and how many beds available and how many beds filled. We need important information. An analysis done worldwide on intensive care unit strains and mortality risks are among critically ill. Critical care survival rates in COVID patients important. Mortality in patients admitted to ICU. What factors are associated with increased mortality? ICU and ventilator mortality among critically ill patients, and studies linking hospital ICU capacity to COVID-19 mortality rates. There have been meta-analyses of data, doctors, on Medline, Embase, PubMed databases have published data on deaths in intensive care as a proportion of completed ICU admissions. Observational studies, including 43,000 patients, report from Middle East, South Asia, Australasia, National and Regional Registries Association, and associations of anesthetists. This was done in February 21. And they show that ICU deaths range from 10%, 1 in 10. In Victoria, Australia is 1 in 4, 25%. And in most countries, you have maximum of 3 out of 10 dying. What is ours in Trinidad and Tobago as deaths as a proportion of completed ICU admissions? We have no information, none. Who from the medical team of advisors can provide this information? None has been doing it. Now, doctors, why? Is it incompetence? Is it unwillingness to have that information available? I have been advised that at least 8 out of 10 admissions in our ICU die and pass away, unfortunately. There has been devastating impact on the failed COVID response on the education of our children. And may I speak for a few minutes on this? Almost 2 years in our education system under this government, almost 70,000 students were left out of any education because of their inability, because of their poverty, because of the difficulties in financial capacity at home, to have learning devices available. And the Ministry of Health, Ministry of Education, for almost 18 months only, they were begging corporate sponsors, corporate bodies, to help with these devices. How sad and unfortunate. For 6 years, from 2015 to 2021, P&M governments have failed the students of this country. They have wiped out 2 generations of students. Don't they have a heart to know that 70,000 students were not receiving education because of they had no online learning capacity? What did they do? This is a year and a half into this government, and still 40,000 students are without these IT devices, and the supporting platforms fail. When Mrs. Bissessa demitted office in 2015, well, everybody knows we gave out 95,000 laptops. Mrs. Prasad Bissessa had a vision. And if we had followed that 6 years later, we would have been 11 years from 2010 when we gave out the first laptops. And students would have been in university, and the important aspect of the IT work would be multiplying. But you stopped it, P&M stopped it, 2015. And Mrs. Prasad Bissessa, as Prime Minister, had pledged that his primary school students would have tablets as well. We had online technology already, and we had e-books designated to come in 2016. And we would have been amongst the top countries in the world moving ahead with IT. But today, 40,000 students are still not having IT devices, and you now want to do a means test. The wealthy students would have bought their laptops and their IT devices. They would have gotten their education. But the poor students have not received their education. And what are they going to in this term coming up here? 2 years have almost passed. And still, as school reopening is contemplated for September, no support is still not provided to thousands more. And they continue to beg corporate citizens. And what about the mental health of our students? And they have been seriously impacted. Their behavioral, social, educational, and psychological development have been thwarted, yet no programs have been developed by the Ministry of Education to assist these students. This is poor governance. This is a failed government, creating and manufacturing a failed state. This is poor management by the Prime Minister and his team, whether it's health, education, whether it's finance, and my colleagues who have spoken before and will continue to speak. Very disturbing. Where are we going? In a bottomless pit. We're going as a Z-class country in the world now, one of the worst. So today, I gave you some ideas on where we are in terms of the governance and the management of this COVID-19 pandemic by this administration. They have failed, and continue to fail, and continue to endanger the loss of lives of our lovely citizens. It is shameful, disgraceful, unacceptable. Thank you very much.
Thank you very much, Dr. Gopi Singh. Listening to Dr. Gopi Singh really tells us what could have been a very eminent doctor in addition to a lecturer. Used to be a lecturer also at the University of the West Indies. How the outcomes could have been so much better. Not only that, the honorable leader of the opposition would have visited the Prime Minister. Accompanying her was Dr. Gopi Singh at the time, but the Prime Minister refused the help of the opposition at that time. All right, ladies and gentlemen, thank you so much. If you'll just hang on a little bit more, because I want to bring to your attention the fact, based on what the Honorable Prime Minister said on Thursday, 22nd, that tomorrow the Cabinet had approved on Thursday, that is, the proclamation of an act, the bill known as an act to amend the Tobago House of Assembly Act, Chapter 2503, and to make consequential amendments to the Election and Boundaries Local Government THA Act, Chapter 25(5). Now, you'll recall that on the 25th of January, elections were held in Tobago, the Tobago House of Assembly election. There were 12 electoral districts, and the outcome was 6 seats went to of those EDs went to the PNM, and 6 went to the People's Democratic Patriots, PDP. As you are aware, to this day, the Assembly remains dissolved, and it has been deadlocked at 6-6. as there was no agreement subsequently with respect to the election of a presiding officer. Now, at Section 5 of the THA Act, it says the assembly shall be a body corporate and consists of 12 assemblymen, 4 councillors, 3 for the majority, 1 for the minority, and 1 presiding officer. So it was stuck at the level of the presiding, voting in the presiding officer. Now I quote the leader of the opposition very briefly, when she said the PDP in Tobago, the Tobago arm of the Trinidad and Tobago Chamber of Commerce, as well as several independent writers have all agreed that a new election is not the way to go. This is now subsequent to the 6-6. And in summary, the present law states that where there is an absence of procedure in the Tobago House of Assembly standing orders, then the standing order of the House of Representatives must be utilized. That is the law. So there exists a clear path, and this, I mean, reporters, I know you'll have questions after. You'll probably ask, why didn't the opposition say that? It was said ad nauseum in the upper house and in the lower house during that debate. So there exists a clear legal path to resolve the current 6-6 THA deadlock through the drawing of lots, and that has been prescribed in the Tobago House of Assembly Standing Order 92-1. When you go there, the 92-1, it leads you, it says, in any matter not herein provided for, resort shall be had to the usage and practice of the House of Representatives of Trinidad and Tobago, which shall be followed as far as the same may be applicable to this assembly and not inconsistent with these standing orders nor the practice of this assembly. So it takes you to the House of Representatives Standing Order 410, and in House of Representatives Standing Order, and it says, if after the holding of a ballot referred to in paragraph 9, which was the, sorry, let me read paragraph 9 of the standing order. Otherwise, the candidate with the fewest number, that is if they continue to cast their ballots, otherwise the candidate with the fewest number of votes shall be eliminated and the ballot held again for the remaining candidates until one candidate receives the vote of a majority of members of the House. 10 says, if after the holding of a ballot referred to in paragraph 9 of this standing order, the votes remain equal, the clerk must determine by lot which candidate is to be eliminated. By lot, and that is what it says. That is the House of Representatives Standing Order that exists today. This is the law of Trinidad and Tobago. The Prime Minister, when he debated, when he piloted the bill on the 19th of February, 2021. Now, this election was held on the 25th of January 2021. And by the 19th of February, not even a month after, the government was in the Parliament with an amendment bill where the Prime Minister said in his Hansard, when he said, you know, I'm getting a lot of advice, and that was his Hansard of 19th of the 2nd, 2021. He said, everything else, whatever, all this is good suggestion, good idea. But it is monkey kuhu, not law. That's what he said. You know, and I mean, Trinidad and Tobago, we like a good fatigue. We get carried away by old talk. But, you know, I mean, we have to, in the fog of prime ministerial nonsense, we have to remember that we remain a democracy. And we adhere to the principle of a democratic practices and principles within the context of Trinidad and Tobago. So we can't go into monkey kuhu. That is not in law. What is in law? It's the standing orders of the Tobago House of Assembly, which now the standing orders of the House of Representatives will then take precedent. That's the law. That was very clear. But the Honorable Prime Minister decided that less than a month after the election, he had no interest in that, and there was going to be a bill which was going to amend these two acts, and this bill is being proclaimed tomorrow, if it has not been proclaimed already, but they have put tomorrow as the date. So what does this say, essentially, in amending these both pieces of legislation which already exist? It's clause 4 in section, they're saying to amend section 5 of the THA Act, and by deleting the word 12 and substituting the word 15. That's the magical thing. When we say 12, we are talking about 12 electoral districts and substituting it to 15. By the stroke of a prime ministerial pen, 12 becomes 15. We are in a democracy, and we adhere to the rule of law. And so says the Prime Minister in his Hansard. So this brings me, so this law really and truly, which is being proclaimed tomorrow, will serve as an instruction, so said the government, to the Election and Boundaries Commission to go out and find 15 seats. Now, when we were debating the bills in February and early March, I recall the Newsday, and you all are here, and the EBC said no increase to 15 seats until THA bill becomes law. Well, I don't know if that is creative license or if they really said that, but I want to quote what this Mr. Clint Chantak article of Sunday, 21st February 2021. And he said on Saturday, EBC Corporate Communications Manager Bobby Rogers said the Commission cannot make any change just yet, although the bill was passed in the House of Representatives on Friday with a government majority vote of 21 to 18. We have to wait until, of course, the bill is debated in the Senate and there is proclamation and passage, Rogers told Sunday Newsday. That is when we move into effect. There isn't anything that can be done before then. Well, I want to remind Mr. Rogers that there is something called a Constitution of Trinidad and Tobago, and it is the supreme law of the land. And in Section 70 and 71, yes, no, sorry. It is 71 and 72. Well, right. Part 4, Election and Boundaries Commission, the Constitution. So it speaks about the Election and Boundaries Commission, and it speaks about the division, but in 71.8, it has the Commission may regulate its own procedures. 71.12, in the exercise of its functions, under this section, the Commission shall not, there's no discretion. The Commission, so when Mr. Rogers jumping up and saying here, I don't know where he's coming from. It says the Commission shall not be subject to the direction or control of any other person or authority. That is the law of the land. This has not changed. All right, so I don't understand, and the UNC went into the Parliament at both houses and would have put that into the public domain and would have debated and argued that even in response to the Prime Minister's piloting. Now, the Election and Boundaries Commission, by law, every 4 years, they go out, and by law, there's a report which is laid in the Parliament. So this is the Election and Boundaries report of 2016. I want to just go back very briefly to 2016. And it's the report of the Election and Boundaries Commission on its definition and review of the boundaries of the electoral districts in the electoral area of Tobago. And that is law. That is captured in the law, Election and Boundaries Commission, Local Government and Tobago House of Assembly Act. This is law. This is settled law in Trinidad and Tobago. So here they are, according to the settled law, they are following through. And they are saying in accordance with Section 4 of this piece of law, the Election and Boundaries Commission, Local Government and Tobago House of Assembly Act, Chapter 25(5), they now go out to review. And when they went out now, based on their report, they said their last report was on the 8th of October 2012 at the time. And I'm coming down to number 6. Para 6 of their report. They say, consequently, the Commission considers that no adjustment is necessary to the boundaries of the electoral districts in the electoral area of Tobago. The Commission accordingly recommends that there should be no change in the boundaries of the 12 electoral districts in the electoral area of Tobago. And they go on to 7. The Commission further recommends that each of the said 12 electoral districts, so it's repeated, in the electoral area of Tobago should carry the names, etc., and they have it in an appendix. And here you see the signatures of the people who comprise the Commission. That's it, signed. Dated this 29th day of September 2016. Now, 4 years later, because the law said they will produce this report not more than every 2 years, and not less than every 2 years, but not more than every 4 years. And they have gone with every 4 years. So in 2020, the last one was 2016. In 2020, they have produced this report similar report by law, the 12th report. The report before was the 11th report. So they are going sequentially, very nicely. And this report now, this 12th report, it's the same thing. You have to submit this report to the Minister of Local Government. At that time, it was the Honorable Franklin Khan. This time, it was Mr. Kazim Hussain. And this report is dated, as I said, the 8th of September, 2020. That's last year. And what did they say at this number, this magical number? I think is it 6 again. They went through and they did their formula, etc. And they would have come again and they have said at number 7, number 6. Consequently, the Commission considers that no adjustment is necessary to the existing boundaries of the electoral districts in the electoral area of Tobago. And 7, the Commission accordingly recommends that there should be no change in the boundaries of the 12 electoral districts in the electoral area of Tobago. And 8, the Commission further recommends that each of the said 12 electoral districts in the electoral area of Tobago should carry the names, etc. Dated this 8th day of September 2020. And again, you see the Commission. That was last year, September, laid in the Parliament. This was laid in the Parliament, as the law would have said that they must do. This law is what told the EBC what they have to do, right? So you lay it in the Parliament. What happened between September 8, 2020, and when they went with this, the 19th of February 2021, when this bill was piloted, there was an election. And the PNM got the shock of their life when some young people just beat the pants off of them. That's all that changed. You understand? They just got a flogging because they went in with 10 seats, they came out with 6. And then according to the law, because they couldn't resolve this presiding officer, you stay on until such time as you can come to some arrangement. So that is all that changed. And the Prime Minister and the government decided, the cabinet decided, they're going to change this to 15 seats. But the EBC did not say that. And it will be 2 years, no less than 2, no more than 4, which no less than 2 is next year. No more than 4 is 2024, before they could go back and do this. That is the law. And the Prime Minister said he's following the law. That he made that very clear.
It's in the Constitution.
Yes, he must follow the Constitution. Nobody is above the law. I mean, Dr. Gopi Singh made the point just now. You understand that this, then, if it is you're not following the law, it means we're on a different path altogether, right? So therefore, I want to remind the Election and Boundaries Commission that there is something called the Constitution, and they as a body, they have been highlighted in that, and their role has been identified as that of an independent. You shall be independent, and so on. And basically, the Citizen of Tobago have expressed their will on the 25th of January 2021 in those elections. And if it is the PNM government are dissatisfied with the results, that is a matter for them. That is not a matter for the general citizenry. They have said, they have spoken. And they want, as the PDP would have said, they have said, okay, we are going to give you the presiding officer. We are going to give you the chief secretary. Let's get on with it. Maybe when you would have resolved yourself into an assembly, you could then come to some agreement that we could dissolve at this time, you understand, and go back to the Prime Minister, go to the President, etc. But as the UNC position is, there is an arbitrariness in going ahead and deciding that I'm going to come with 15, I'm going to just put 15 seats, contrary to what the EBC would have said in this 12th report of last year. Now, when the Prime Minister explained himself, he said, well, you know, when after the 2016 or thereabout, a group of people had come together in Tobago, some leaders in Tobago, all the opposing forces would have come together with then Chief Secretary London, etc. And they would have said, look here, we want 15 seats. But even that is arbitrary, even if they could want. You could want something, but if it's not the law, it's not the law. You know, there's a process by which you could get to 15. Why not 13? Why not 14? Why not 18? You know, so they would have said, we wanted that. That is correct. And it is encapsulated in this document, 2013 to 2017 session, Tobago House of Assembly, Republic of Trinidad and Tobago. This was what Tobago would have sent down as an act to amend the Constitution of the Republic of Trinidad and Tobago to accord self-government to Tobago and for matters incidental thereto. Now, the Prime Minister very conveniently pulled out the 15 seats. from this document, but he didn't pull out anything else. It had what constituted Tobago, the definition of Tobago, what was its maritime borders. Tobago had said we wanted 8% in terms of a piece of the national budget. They had said we wanted a bicameral house. We want the Tobago Assembly, and then we want something called the People's House. You know, so we have two sets of people, like the way we have the lower and upper house in Trinidad. And so many other elements they had wanted in this document that they did not get. But suddenly they can get the 15 seats that just come out of thin air. We say no. So we call on the independent EBC to just point the Honorable Prime Minister in the direction of their recently laid report, and to, on behalf of the people of Trinidad and Tobago, to do what is in the best interests of the people and maintain the independence that is enshrined under the Constitution. Very, very briefly again, I just want to speak about this company called the National Gas Company. Last week's Saturday Guardian had the front page had the NGC's $250 million debacle, or blunder, sorry. And this was a company that from 2011 to 2015 would have returned to Trinidad and Tobago dividends of about $13 billion and taxes of about $7 billion, so $20 billion in all. Today, they are reporting losses of $2.1 billion. So this $250 million blunder has been well documented, where the National Gas Company would have gone, notwithstanding who has a 10% interest in a company called Atlantic LNG. The other 90% are in two multinationals, BP, TT being one. And they own 90%. When the National Gas Company would have said they had an interest in doing what is called a turnaround, meaning an upgrade of the plant, those with the 90% interest said, no, we don't have any gas for this. We don't think the plant is efficient at this time. You don't have any customers, what they call the uptake for your product, etc. Where is your economics? But they went ahead and they spent $250 million for nothing, and then you have no gas. So the Guardian lead business editor stated in that article that he would have sent 6 questions to the Honourable Minister of Energy via email, and then proceeded to call him on 5 occasions, which he did not, and he didn't answer. So there were 6 questions he sent, and he has had no answer. So I just want to very quickly assist the Minister of Energy, and maybe assist the Guardian lead editor and the media as a whole. So because these questions are burning questions, all right, because in this time when you would have heard Dr. Gopi Singh talking about the 40,000 students still without devices. You know, we don't know if we're coming or going with the vaccine, the health system, people are outside in tent, and that is just a part of what is happening in this country. And the beat goes on, nobody is answering, because it's either they say they are covered and protected by something called an NDA now, that is popular thing, the non-disclosure agreement. Everything is a secret. They are telling you our negotiations are in a very sensitive stage. So they can't tell you how they are spending 1 cent, $1 of taxpayers' money, because it is a secret, and it is their secret, but they're spending your money while they keep their secret. And that is not, I think that is not a matter for Trinidad and Tobago. That is a matter that the Prime Minister, instead of thinking about how he gonna look, whether he looks like a dictator or he looks like an autocrat, or how he gonna look, that is a matter for him, right? But all that will guide us to how he looks is his attitude, the way he conducts himself and conducts the business of the people of Trinidad and Tobago. So number 1 question, when was the decision taken to decommission Train 1? No decision has been taken to decommission, that's the answer, Train 1 at this time. The various scenarios are currently on the Minister of Energy's desk for a sign-off, but the recommendation of the NGC is that the plant should be decommissioned and no more money should be pumped into it. How much money has been spent by the NGC on its turnaround? Approximately $250 million has been spent on the phase 1 of the Train 1 turnaround. Question 3, is that money now lost? Yes, and according to the former chairman of Petrotrin, all $250 million is gone. It's lost. Was the decision to pursue operating Train 1 driven by economics? The management went to the board with no economics, and there were dissenting views at the board level, which resulted in one director stepping down. He's gone. But what I'm hearing now is other directors are asking if there is any indemnity, and if the indemnity could be retroactive to this Train 1 debacle. So there was no economics to drive the decision to operate Train 1. NGC was told by the upstreamers and its majority shareholders that there was no gas for Train 1, and NGC had no offtake contracts for LNG. So where is the economics? There is no input and output, but there is an investment of, well, 35 million US dollars, and if there is no one accountable. Question 5, were the central issues lack of natural gas, safety and environmental? These are not my questions. These are questions from the media. The central natural gas production is in decline, so there is no gas for a 4th train. And this was stated to NGC by BPTT, the optimal operations for 3 trains. So what they are saying, in effect, is you have 1, 2, 3, 4 trains. You could do 2 and 2, 3, 4. You could do 1, 2, 3. You could do A1. But it's 3, right? That was said very emphatically. The LNG plant is less efficient when recently benchmarked against other plants around the world. And the multinationals are now pursuing a green agenda. I mean, one could see what is happening around the world. In America right now, West America, you have fire raging at 1,000 acres per minute. You understand? You have in Western Europe, you have what they're calling the floods that they have not seen in 100 years. In China, there are floods that you have not seen in 1,000 years. So climate change is here. So these folks are moving. So the question has to be asked, what is the real outlook for our gas industry given the move to net zero by these multinationals? And clearly they are now in a transition phase. And if they are putting 2030, which is 9 years away, as their kind of look ahead of transferring significant, well, 50% of the energy requirements of, well, their communities, their countries, and these countries set the price, they set the policy. I mean, we are really lagging behind by dumping money into plants that are very inefficient with old technology. And 6, is there a way forward for Train 1? No. Based on the gas supply in the country at this time, there is only gas for 3 trains. Now, I had some additional questions, but I'll send them out to the media, because I know we have been here and we have been trying to really put out the information as we have it. We are trying to put out the alternative view and what we think is a very responsible approach to governance. Because what we are seeing passing for governance in this country is folks who want power, they want the prestige of the office, but they want the authority of telling you when you could go and when you could come, when they could close border. They close border, they tell you when you go to sleep. There was a time, 10 o'clock, we had to close in our door, 10 o'clock in the day. You had to close in and go inside. Why? Because they tell us that. We have to go inside. We don't want to see you on the road. You can't walk, you can't exercise on Chancellor. That is what they use, that authoritarian approach to tell you what you could do and what you cannot do. All right? But they don't want any responsibility. They don't want to answer any question. They have no time for you. They say it is monkey cocoa when you ask them any question. And they drive. Recently, I was seeing a video where the media was told, when I invite you to this house, you know, I expect you, well, I'm paraphrasing now, I expect you to behave yourself, eat your biscuit and shut your mouth and just ask the question that I want to answer and tell me that I'm so lovely and I'm doing a great job. Just compliment me and go about your business. I think that is what, but that is not a democracy. That's not a democracy. So I thank you so much for attending our press conference. Any question? Are there any questions?
Just a few.
Yes.
So I have a thought of you.
Yes, thank you.
So let's speak hypothetically.
Mm-hmm.
In the event that the DHA Act is amended to accommodate the changing of the 12C315, and what are the repercussions of that?
Well, that is ultra vires law because there's a remedy in law in the standing orders to treat with that. So I am Tobagonian, and I believe the Tobagonians would have spoken and they would have said, we want 6-0 and we want 6-0. And you cannot now come and suppress and repress and take away what the Prime Minister, when he piloted the bill, what he said was elections that were free and fair and free from fear. He actually said that. So if these elections were free and fear and free from fear, why are they then being, why is the rights of the Tobagonian now being taken away? Why is it being negated?
I have a few
Yeah.
questions. So you mentioned the issue of 70,000 students being left behind during the pandemic. The Ministry of Education has said that they are tackling the issue of learning loss recovery. They're involving the police and the Ministry of Social Development to locate these students. What are your thoughts on this plan?
Well, I think it's 2 years too late. That should have been done within the first month. The Ministry of Education has 17 supervisors, SS3s. They have a number of SS2s, school supervisors, 2 and 1. Who could have done that job very quickly within a month period, collate the information about students who were affected and who were not able to receive education through their devices, how many had no connectivity, and that would have been done in 1 month if they were an efficient ministry. So to say now they're looking into it and now trying to get more information, I find it is appalling. It shows the level of competence and the level of management. I think the Minister of Education needs a lot of help inside there. There are a number of school social workers as well. Under the previous administration between 2015 and 2020, a number of those had been dismissed. So school social workers, guidance counselors, guidance officers, we had over 700. Mrs. Prasad Bisesa had increased that amount from 400 to 700 to do the exact type of thing of support to children during her time of administration and during the time I was Minister of Education. So you have school supervisors, you have school social workers, you have guidance counselors, guidance officers, and you have the principals. That can't take more than 1 month to get the information. So where is it? The students are registered, their addresses are there, their telephone numbers, contacts are there. Just call, just go find out. So it shows a level of incompetence that is pervasive.
You also mentioned holiday in Tobago, right? But Tobago has been calling for the reopening of travel and business as the tourism industry continues to suffer. So from your perspective, what are your thoughts on reopening commerce in Tobago and here as well, especially if you're seeing that the effects of the pandemic are so dire right now?
Well, they have not been able to curtail the spread of the infection. In fact, on a daily basis, people are trying to waking up to find out how many patients really died. The real issue is not so much, the real issue is the deaths, to lose a family member. So when every day, some days you're hearing 17 persons died, and in Tobago now you have 34 people, I understand, who died in Tobago, and the amount of infections have increased considerably, all because of the movement and the commingling of the 50,000 during the time that Trinidadians and Tobagonians were going back to Tobago and intermingling during that period. There was a stark increase. And also when they invited in Trinidad for the aged to go to the health centers for their vaccine, there was a large congregation within a few hours, and some of those who went to get help to have the vaccine, some of those would have passed away in May, June, and July. I think I have something here which show, well, COVID destroyed by family. Here was the minister blaming, the CMO blaming the deaths on health woes. I'm a doctor for 45 years, and your job is to really take care of these health issues. And the Minister of Health, between 2010 and 2015, and even up to today, they have not opened back the health centers to at least 9 o'clock in the night. You have 105 health centers where you could have been providing care for these patients with diabetes and hypertension and other issues, and to prevent them from reaching the stage where their diabetes is uncontrolled now. But they closed them down. Then when we raise the issue of the type of medication they're giving them, metformin for the diabetes and the hypertensive one, the other antihypertensive drug, the Minister of Health is a pharmacist. He knows what I'm speaking about. He promised to change the medication to make them much more effective and efficient. So patients have been continuing to receive pharmaceuticals for the management of diabetes and hypertension with less than effective and efficient pharmaceuticals. So in terms of opening, that is a difficult question. The issue is that people are really suffering, businesses are suffering, and I think it has to be considered very urgently. The poverty is becoming increasing, and people, over 200,000 people are really out of jobs at this time, subsequent to the COVID. So this is where the minds should come together. If we were in government, or if, as we in opposition, Mrs. Prasad Bisesa as opposition leader, have a meeting of both teams, have a meeting of the minds, and the country will see that the best minds are being put together in the decision-making process, rather than an autocracy.
So you also mentioned addressing the government hasn't really addressed the virus in a timely manner. The government has said that the reason for delayed vaccination was the global issue of a lack of availability of vaccine. So are you saying that there was any other way for us to access the vaccines to tackle the pandemic that was overlooked?
It goes back to January 2020, when we raised the issue as an opposition. And they failed to discuss it on 5 occasions. We knew that this thing was a major pandemic. We knew that it was going to have devastating effect, but they refused to discuss it. And when the United States and Great Britain and the developed countries, they did not wait for WHO permission to begin to seek vaccines then. They know that the manufacturers were in the process of making vaccines. So they began to put in their orders very early. And Honorable Prime Minister of Trinidad and Tobago was head of CARICOM for 6 months from January to June. CARICOM countries wanted vaccine. So why not in January 2021, you put in a 5 million request or 10 million for more Caribbean countries and get other Caribbean countries to decide to purchase. But you're going to do that in April, May, where by that time, most of the vaccines are taken up already. So from the time that you know that there is a pandemic and the manufacturers of vaccines are on board, the other countries began to put their orders in without WHO acceptance. And so that when WHO accepted, it was easy for them to get their vaccines, but sitting on your hands and doing nothing is totally unsatisfactory. And you have to blame yourself for the lack of vaccines and for the late start. A lot of these lives could have been saved if the vaccinations of senior citizens and those above 60 with comorbidities had been vaccinated early. And if they had been vaccinated in January, February, March, or April, you would have had less deaths in May, June, and July. So here it is, they're trying to ramp up their vaccination. But the other issue in the vaccine, they said, the minister said that they had everything planned about the vaccination program and so on. They're still fiddling with issues of where to vaccine. DOMA assists in mass vaccination of retail sector. They're now begging everybody, why weren't these preparations made at an early stage in last year, 2020, when we get the vaccines? We will have these centers to distribute and work out the logistics of it and get some of the best minds in logistical disposition of things. Ministry test drive through vaccination site, one begins tomorrow. They're now testing. SAPA conducts pilot study for drive-through vaccines. They're late on the ball. The goal has already been scored. The century, 1,000 people, unfortunately, the families have lost their lives, wiping out families, generations. This is painful. You know, I'm a doctor for 46 years, and I've attended to over 120,000 patients in my life. And I have 31,000 private patients in Trinidad, or even more. And I can't recall losing a patient on the operating theater table or losing a mother at delivery. And for us as senior doctors, you ask any one of my colleagues, one death is too much. It's painful. If one of us lose a patient, we can't sleep in the night. We try to go back. Where has there been a fault? Did we do our best for the patient? When you have to operate on a patient, you have to think the night before, all your systems, how you're going to manage the patient. And one loss of life. But here we have 1,000 people dying and nobody's asking anything. I find it is... Yeah. I find it bewildering. Has anybody asked and gotten the answer? How many people really survive in the ICU? I've had about 25 calls from various patients, families. Dr. Gopi Singh, we need help. We can't hear what is happening to our mother or father or brother or sister or aunt or uncle. For 21 days, sometimes you cannot get one call from the centers to tell them what is happening to the families. It's only when they're dead. And the families are called sometimes a few hours after the patient dies. That's when they know for the first time. That is painful, and that is totally unacceptable. That is shameful. And those who come on television on a weekly basis or on a daily basis, the death of these patients are on your hands.
Thank you so much for coming.
Thank you very much, Abina.